Hi everybody, this video of mine is about a very important topic, that is migraine. A migraine can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It is often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with your daily activities. For some people, a warning symptom known as an aura occurs before or with the headache. An aura can include visual disturbances such as flashes of light or blind spots, or other disturbances such as tingling on one side of the face or in an arm or leg and difficulty speaking. Medications can help prevent some migraines and make them less painful. The right medicines combined with self-help remedies and lifestyle changes might help. Now let me tell you the symptoms. Migraines, which often begin in childhood, adolescence, or early adulthood, can progress through 4 stages: prodrome, aura, attack, and post-drome. Not everyone who has migraines goes through all stages. Now let me tell you about the first stage, that is prodrome. 1 or 2 days before a migraine, you might notice subtle changes that warn of an upcoming migraine. These include constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased thirst and urination, and there could be frequent yawning. The second stage is aura. For some people, aura might occur before or during migraines. Auras are reversible symptoms of the nervous system. They are usually visual but can also include other disturbances. Each symptom usually begins gradually, builds up over several minutes, and lasts for 20 to 60 minutes. Examples of migraine aura include visual phenomena such as seeing various shapes, bright spots, or flashes of light. Vision loss, pins and needle sensation in an arm or leg. Weakness or numbness in the face or one side of the body. Difficulty speaking, hearing noises or music, uncontrollable jerking or other movements. Now the third stage is actual attack of migraine. A migraine usually lasts from 4 to 72 hours if untreated. How often migraines occurs varies from one person to person. Migraines might occur rarely or strike several times a month. During a migraine, you might have pain, usually on one side of your head, but often on both sides. Pain that throbs or pulses. Sensitivity to light, sound, and sometimes smell and touch. You may suffer from nausea and vomiting. The last stage is post-drome. After a migraine attack, you might feel drained, confused, and washed out for up to a day. Some people report feeling elated. Sudden head movement might bring on the pain again briefly. Now let me tell you when you should see a doctor. Migraines are often undiagnosed and untreated. If you regularly have signs and symptoms of migraine, keep a record of your attacks and how you treated them. Then make an appointment with your doctor to discuss your headaches. Even if you have a history of headaches, you see your doctor if the pattern changes or your headaches suddenly feel different. You should see your doctor immediately or go to the emergency room if you have these signs and symptoms which I am going to tell you, because these signs and symptoms could indicate a more serious medical problem. These are an abrupt severe headache like a thunderclap, headaches with fever, stiff neck, mental confusion, seizures, double vision, weakness, numbness, or trouble speaking. Headaches after a head injury, especially if the headache worsens. A chronic headache that is worse after coughing, exertion, straining, or a sudden movement, or if there is a new headache pain after age 50. Now let me tell you the causes of migraine. Though migraine causes are not fully understood, genetics and environmental factors appear to play a role. Changes in the brainstem and its interaction with the trigeminal nerve, which is a major pain pathway, might be involved. So might imbalances in brain chemicals, including serotonin, which helps regulate pain in your nervous system. Researchers are studying the role of serotonin in migraines. Other neurotransmitters play a role in the pain of migraine, including calcitonin gene-related peptide. The abbreviation is CGRP. Now let me tell you some triggers of migraine. There are a number of migraine triggers which include hormonal changes in women, fluctuations in estrogen such as before or during menstrual periods, pregnancy and menopause seem to trigger headaches in many women. Hormonal medications such as oral contraceptives and hormonal replacement therapy also can worsen migraines. Some women, however, find their migraines occurring less often when taking these medications. Drinks. These include alcohol, especially wine, and too much caffeine, such as coffee. Stress. Stress at work or home can cause migraines. Sensory stimuli. Bright lights and sun glare can induce migraines, as can loud sounds, strong smells, including perfume, paint thinner, second-hand smoke, and others. Others trigger migraine in some people. Sleep changes. Missing sleep, getting too much sleep, or jet lag can trigger migraine in some people. Physical factors. Intense physical exertion, including sexual activity, might provoke migraines. Weather changes. A change of weather or barometric pressure can prompt a migraine. Medications. Oral contraceptive and vasodilators such as nitroglycerin can aggravate migraines. Foods. Aged cheeses and salty and processed foods might trigger migraines, so might skipping meals or fasting. Food additives. These include the sweetener aspartame and the preservative monosodium glutamate (MSG) found in many foods. Now coming to the risk factors. Several factors may make you more prone to having migraines, which include family history. If you have a family member with migraines, then you have a good chance of developing them too. Age. Migraines can begin at any age, though the first often occurs during adolescence. Migraines tend to peak during your 30s and gradually become less severe and less frequent in the following decades. Sex. Women are 3 times more likely to have migraines. Hormonal changes. For women who have migraines, headaches might begin just before or shortly after onset of menstruation. They might also change during pregnancy or menopause. Migraines generally improve after menopause. Now let me tell you the complications. Taking combination painkillers such as Excedrin migraine for more than 10 days a month for 3 months or in higher doses can trigger serious medication overuse headaches. The same is true if you take aspirin or ibuprofen for more than 15 days a month or triptans for more than 9 days a month. Medications overuse headaches occur when medications stop relieving pain and begin to cause headaches. You then use more pain medication, which continues the cycle. Now let me tell you the diagnosis of migraine. If you have migraines or a family history of migraine, a doctor trained in treating headaches will likely diagnose migraine based on your medical history, symptoms, and a physical and neurological examination. If your condition is unusual, complex, or suddenly becomes severe, tests to rule out other causes for your pain might include an MRI. MRI scan uses a powerful magnetic field and radio waves to produce detailed images of the brain and blood vessels. MRI scans help doctors diagnose tumors, strokes, bleeding in the brain, infections, and other brain and nervous system conditions. A CT scan. A CT scan uses a series of X-rays to create detailed cross-sectional images of the brain. This helps doctors diagnose tumors, infections, brain damage, bleeding in the brain, and other possible medical problems that may be causing headaches. Now let me tell you the treatment of migraine. Migraine treatment is aimed at stopping symptoms and preventing future attacks. Many medications have been designed to treat migraines. Medications used to combat migraines fall into two broad categories. The first category is pain-relieving medications, which are also known as acute or abortive treatment. These types of drugs are taken during migraine attacks and are designed to stop symptoms. The second category is of preventive medication. These types of drugs are taken regularly, often daily, to reduce the severity or frequency of migraines. Your treatment choice depends on the frequency and severity of your headaches, whether you have nausea and vomiting with your headaches, how disabling your headaches are, and other medical conditions you have. And now let me tell you the medications for relief of migraine. Medication used to relieve migraine pain work best when taken at the first sign of an oncoming migraine. As soon as signs and symptoms of a migraine begin, medications that can be used to treat it include pain reliever. These over-the-counter or prescription pain relievers include aspirin or ibuprofen. When taken too long, these might cause medication overuse headaches, which I told you before, and possibly ulcers and bleeding in the gastrointestinal tract. Migraine relief medication that combine caffeine, aspirin, and acetaminophen, which is known as Excedrin migraine, may be helpful, but usually only against mild migraine pain. The next comes triptans. These are prescription drugs such as sumatriptan and rizatriptan. These prescription drugs used for migraine because they block pain pathways in the brain. Taken as pills, shots, or nasal sprays, they can relieve many symptoms of migraine. They might not be safe for those at risk of a stroke or heart attack. The next category of medicine is dihydroergotamines, DHE45, that comes with the name of Migranal. This is available as a nasal spray or injection. These are most effective when taken shortly after the start of migraine symptoms or migraines that tend to last longer than 24 hours. Side effects of these medicine can include worsening of migraine-related vomiting and nausea. People with coronary artery disease, high blood pressure, kidney or liver disease should avoid these medicines, which are known as dihydroergotamines. Okay, it's a difficult name. Okay, anyways. Another medicine is lesmeditan, that comes with the trade name of Revo. This new oral tablet is approved for the treatment of migraine with or without aura. In drug trials, Revo significantly improved pain as well as nausea and sensitivity to light and sound. Revo can have a sedative effect and cause dizziness, so people taking it are advised not to drive or operate machinery for at least 8 hours. Revo also should not be taken with alcohol or other drugs that depress the central nervous system. Then the next drug is obrogepant. This oral calcitonin gene-related peptide receptor antagonist is approved for the treatment of acute migraine with or without aura in adults. It is the first drug of this type approved for migraine treatment. In drug trials, ubrogepant was more effective than placebo in relieving pain and other migraine symptoms such as nausea and sensitivity to light and sound 2 hours after taking it. Common side effects include dry mouth, nausea, and excessive sleepiness. Ubrogepant should not be taken with strong CYP3A4 inhibitor drugs because of the risk of drug interactions. Then the next category is opioid medication. People who have migraine who cannot take other migraine medications, narcotic opioid medications, especially those that contain codeine, might help because they can be highly addictive. These are usually used only if no other treatments are effective. Then I should tell you about anti-nausea drugs. These can help if your migraine with aura is accompanied by nausea and vomiting. Anti-nausea drugs include chlorpromazine, metoclopramide, or prochlorperazine. These are usually taken with pain medications. Now let me explain you the preventive medications. Medication can help prevent frequent migraines. Your doctor might recommend preventive medication if you have frequent, long-lasting or severe headaches that don't respond well to treatment. Preventive medication is aimed at reducing how often you get a migraine, how severe the attacks are, and how long they last. Options of the drugs include blood pressure lowering medication. These include beta blockers such as propranolol that comes with the name of Indrol and metoprolol tartrate. This comes with the name of Lopressor, and some calcium channel blockers such as verapamil can be helpful in preventing migraines with aura. Then comes antidepressant. A tricyclic antidepressant known as amitriptyline can prevent migraines because of the side effect of amitriptyline such as sleepiness and weight gain. Other antidepressants might be prescribed instead. Then the next category of drugs is anti-seizure drugs. Valproate and topiramate, which comes with the name of Tobamax, might help you have less frequent migraines, but can cause side effects such as dizziness, weight changes, nausea, and more. Then we may use this Botox injection. This injection of Botox about every 12 weeks help prevent migraines in some adults. So these Botox injections which are used to treat wrinkles can be helpful in migraine prevention. Okay. The next comes calcitonin gene-related peptide monoclonal antibodies. Abbreviation of this is CGRP. Calcitonin gene-related peptide is abbreviated as CGRP. These drugs, this Aimovig and Ajovy and Emgality, are newer drugs which are approved by Food and Drug Administration to treat migraines. They are given monthly by injection. The most common side effect is the reaction at the injection site. Now I should tell you some lifestyle and home remedies which you can use for treating or preventing migraine. Okay. When symptoms of migraine start, try heading to a quiet, darkened room. Close your eyes and rest or take a nap. Place a cool cloth or ice pack wrapped in a towel or cloth on your forehead or at the back of your neck. Other practices that might soothe migraine with aura pain include some relaxation techniques such as biofeedback. This biofeedback and other forms of relaxation training teach you ways to deal with stressful situations, which might help reduce the number of migraines you have. You must develop a sleeping and eating routine. Do not sleep too much or too little. Set and follow a consistent sleep and wake schedule daily. Try to eat meals at the same time every day. You must drink plenty of fluids. Staying hydrated, particularly with water, might help. You must keep a headache diary. Continue recording in your headache diary even after you see your doctor. It will help you learn more about what triggers your migraine and what treatment is most effective. You must exercise regularly. Regular aerobic exercise reduces tension and can help prevent a migraine. If your doctor agrees, choose aerobic activity you enjoy, such as walking, swimming, and cycling. Warm up slowly, however, because sudden intense exercise can cause headaches. Regular exercise can also help you lose weight or maintain a healthy body weight, and obesity is thought to be a factor in migraines. Now there are some alternative medicine which I should tell you. Non-traditional therapies might help with chronic migraine pain. These include acupuncture. Clinical trials have found that acupuncture may be helpful for headache pain. In this treatment, a practitioner inserts many thin, disposable needles into several areas of your skin at defined points. The next comes biofeedback. Biofeedback appears to be effective in relieving migraine pain. This relaxation technique uses special equipment to teach you how to monitor and control certain physical responses related to stress, such as muscle tension. Then comes cognitive behavioral therapy, CBT. Cognitive behavior therapy may benefit some people with migraines. This type of psychotherapy teaches you how behaviors and thoughts affect how you perceive pain. Then there is the role of some herbs, vitamins, and minerals. There is some evidence that the herbs feverfew and butterbur might prevent migraines or reduce their severity. Though study results are mixed, butterbur is not recommended because of safety concerns. A high dose of riboflavin, that is also known as vitamin B2, may also prevent migraine or reduce the frequency of headaches. Coenzyme Q10 supplements might decrease the frequency of migraines, but larger studies are needed. Due to low magnesium levels in some people with migraines, magnesium supplements have been used to treat migraines, but with mixed results. You should ask your doctor if these treatments are right for you. Do not use feverfew, riboflavin, or butterbur if you are pregnant or without first talking with your doctor. Well, I hope you like this video of mine. If you have migraine or if you suffer from any other illness, please post comments in the comment section of this video, and I'll try to make a video on that topic, or if not possible, I'll try to reply your comments as soon as possible. And if you have not subscribed my channel till now, please subscribe the channel and click the bell icon and select the all options so that all upcoming videos are delivered to your inbox straight away from YouTube. And I think my videos will provide benefit to you or useful to you. And if you think these videos are useful, even if they provide you 5%, 10% benefit to you, then please like this video and share my videos with your friends and families, and share through social media so that everyone must get some benefit, because this my channel tabibi is created to help humanity, and I want that everyone should watch this channel and should seek guidance regarding the health related matters, because if I am able to save even one life of a person, and if you listen to these videos and act according to my advices, because I am a doctor, then I'll be very glad that my mission of creating this tabibi channel for humanity has been achieved. Thank you very much for watching this video. See you in next video. Bye.